Assalamu alaikum, everyone. My name is Melanie. I'm very happy to introduce our topic and panel for today. But before you begin, I would like to ask Sister Berak to please recite some verses from the Holy Quran.
Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen. Wassalatu wassalam ala ashraf al-mursalin, Sayyidina Muhammad wa ali Muhammad. Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen. Ar-Rahman ar-Rahim. Maliki yawmiddin. Iyaka na'budu wa iyaka nasta'in. Ihdina as-sirata al-mustaqim. Sirata alladhina an'amta alayhim. Ghayr al-maghdubi alayhim. Wala ad-dallin. Sadaqallahu al-aliyyul azim.
Thank you, Sister Berak. Before we begin today, I would like to introduce myself. I am a master's student in Islamic studies and focusing in Shia Islam at George Washington University. And here with us today, we have Sister Berak Hussain, who's a Canadian-Iraqi registered psychotherapist, and she practices in health and counseling services at Carleton University for the past 13 years. Outside of her university, she's known as the Muslim Counsellor, and she's a passionate public speaker in Muslim mental health, social justice, domestic violence, women's issues, Islamic issues, poetry, and so much more advocating initiatives. Sister Berak also speaks on a variety of Islamic and psychological issues, which we will see here today, bridging the connection and misconceptions around Islam and mental health. And she also works with youth and parents with cross-cultural generational dialogues and motivational and mindfulness talks. Berak continues to encourage people to reach their full potential with her motto, inspire, heal, and empower. Sister Berak, you always inspire me, and I hope we can all live up to your expectations together this evening. And I would also like to introduce Sheikh Dr. Mehdi Hazari, who's received his doctorate from Johns Hopkins University and is a psychologist, environmental scientist by profession, specializing in neuro and cardiovascular physiology and the studies of the effects of air pollution on human health. Sheikh Dr. Hazari, he also completed his House of Studies, and he's a resident scholar at the Islamic Ahlul-Bayt Association of the Triangle in North Carolina. He is also a member of the Council of Shia Muslim Scholars in North America, and he's a board member of the Imam Mahdi Association of the Marja'iyah, the liaison office of Sayyid al-Sistani. Sheikh Hazari, he contributes to the publication of numerous books and literature dedicated to theology, jurisprudence, and other topics. And without further ado, I would like to introduce our topic for tonight. What is the relationship and level of compatibility with Islam and mental health? How are they congruent? And what is important to understand psychology from an Islamic perspective? And to just kick off our panel discussion tonight, my first question, I would like to introduce to both of our panelists. I want to start by discussing the intersectionalities between the definition of psyche from an Islamic then a psychological perspective. So whoever wants to take this one first.
Assalamu alaikum jami'an wa rahmatullahi wa barakatuh. So I want to welcome everyone to this second webinar on mental health. And hopefully we can have a very fruitful conversation. And I would like to also thank the Muslim counselor, Sister Berak Hussain, and my dear sister Melanie, Mohsen, who have given so much of their time, and I thank them for joining us at the Imam Mehdi Association Marja'iyah's webinar. Maybe I'll go ahead and begin, Sister Melanie, inshallah. So when we talk about the psyche, or we talk about human beings, and inshallah the goal of tonight is to dispel as many myths as we can, and to dispel any sort of misunderstandings about what Islam considers to be appropriate and what Islam does not consider to be appropriate, especially because we believe from our hearts and we practice in our lives that Islam is the code for every human life, for every time, for every circumstance. So when we talk about the psyche, or the sum totality of human consciousness, human reasoning, and human mind, from the Islamic perspective, very simply put, the creation of Allah that is known as human has three components, very, very simply. One is the jism, which is the body, the physical body, and that is comprised of the arms, the legs, the blood that courses through the arteries and the veins. There is also the nafs, or the self, which is, as I like to describe, the animated portion of the human being. It's the part of the human being that allows the person or drives the person to have desire, to have will, to have, God forbid, sometimes even lust and desires that go beyond what is considered to be appropriate for a human being. And then the third component is the ruh. And the ruh, as the Holy Quran describes, is the command of Allah subhanahu wa ta'ala, which He gives to us so we have life and we have ability and we have capability in our lives. Within that system, the composition of a body, the self, and the ruh, these three parts, you see that a human being, one to another, who are independent, who are different, who are unique in their creation, that there are going to be certain aspects that are going to drive them and they're going to determine the type of human being that they end up becoming, or how they change and they morph over the years as they course through life. Much of that is determined by the mind. And Islam defines that, and Islam describes that. The Holy Quran talks about aql and the aspect of thinking and deliberating and reasoning. And hence, when you talk about these, we will get into more of it tonight, you think about this combined organism comprised of the body, the self, and the soul, with a mind that controls it and that is subject to the physical body, but also acts as a universal controller. With that, I hand it all over to my fellow Canadian and terrible Ottawa Senator fan, Sister Berak Hussain.
Here we go again. I can't even do a proper salam now that the Sheikh had to just sling that one in there. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back, everybody, to another amazing program from the Imam webinar series. And right back at you, Sheikhna. You know, you're a Toronto Maple Leafs fan. I am a converted Senators fan. I am a lifelong Maple Leafs fan, just for the record. Thank you so much, Sister Melanie, as well, and Sheikhna, for the wonderful intro and the depth that we've already gone into so far in terms of looking at the self, or psychology rather, from an Islamic perspective. And the way I'm going to describe it and connect with it is congruent with what the Sheikh has already presented. So we're going to look at definitions. So pretend you're in a Psych 101 class, inshallah. Hopefully it won't be too boring. I'm going to make it as animated as possible. So let's look at these definitions in terms of what is psychology. So psychology essentially is the science of mental behavior in the human mind and the professional application of such knowledge towards the greater good. When we take a look at, this is more the modern definition, when we take a look at the definition from before, meaning in terms of Greek and Latin definitions. So the word psychology in itself is formed by combining the Greek word psyche, which means breath, which is the principle of life, soul, and with logia, which comes from the Greek word logos, which means speech, word, or reason. So if we connect it together, then you have the logic of life or soul, technically like that, right? Early use of the word psychology appears in Nicholas Culpeper's mid-17th century translation of Simon Bartlett's, and I have not read these books, just to put that out there, A New Method of Physics, in which it stated that psychology is the knowledge of the soul. So today, like we said, psychology is more concerned with the science or the study of the mind and behavior. And we see that there are many branches of psychology that are differentiated by specific fields to which they belong. So for example, there's such a thing as child psychology, right? Sports psychology, relationship psychology, even animal psychology, believe it or not. So when we take a look at the different schools of thought, just like we have in Islamic schools of thought, we've got the Shafi'i, the Hanafi, the Maliki, the Ja'fari, and the Hanbali, got all of them, yeah. So from the psychological perspective, we do have major schools of thought as well. And I'm going to describe them, and then I'll specifically talk about what I personally connect with in terms of what I follow and how it relates to the work that I do. So first we have structuralism, okay, versus functionalism. So this was essentially the first school of psychology, and it focused on breaking down mental processes into the most basic components. So they have, I'm not going to get into who was who. We don't even know these people now, of course, unless you're hardcore psychology. But essentially it was functionalism, the opposite, was formed as a reaction to the theories of the structuralist school of thought. And it was heavily influenced, again, with people such as William James, so on and so forth. So we also have the second school is behaviorism. So this became the dominant school of thought in the 1950s, and it's based upon thinkers that I'm sure you probably heard some of the, for example, Ivan Pavlov and B.F. Skinner and John B. Watson. I remember those behavioralists from our Psych 101 classes. And so this school of thought holds that behavior can be explained by environmental causes rather than internal forces. And it's focused as an observable behavior. So theories of learning include classical conditioning, operant conditioning, and these were the focus of great research. So Pavlov's dog, any of you have heard of Pavlov's dog? This is something that is used in pop culture. You see it in cartoons and probably in movies these days where the term can be used, but essentially this research was based on how they trained Pavlov's dogs, the dogs that he used in the experiment, to get ready for food that was coming, meaning that they conditioned the dogs that whenever they heard a bell, that means that the bell is related to food. So essentially with that conditioning, the dogs then became salivated as soon as they heard the bell because they associated it with food. So that's the term we can use now. You know, we're like Pavlov's dog. I know in the perhaps the Middle Eastern or our cultural context, compared to a dog, is comparing yourself to a dog is not really, you know, part of our cultural schema of things or the way we speak. But essentially when we're looking at it from the psych perspective,
I don't know what culture you grew up in, but we were calling each other dog all the time.
Okay, that's fine. Exactly. When we call each other dogs, that's exactly what I mean by the cultural taboos, right? To call somebody a dog is not really considered a positive thing. From a psychological perspective, if we're calling somebody who's trained like Pavlov's dog, it means they've been conditioned, right? In terms of the classical conditioning. As soon as they hear something they've been trained to, they respond to it behaviorally. You can see the salivation of the dog. So if we use this now term throughout the session, you know exactly what we're referring to. It is not meant to be calling each other names like, you know, yeah, I'm not going to go there when it comes to hockey, you know, and fans and stuff like that. So the next thing is psychoanalysis, which I'm sure a lot of you have heard of, much more than the structuralism. And of course, we've all heard of Dr. Sigmund Freud, who was the founder of the psychodynamic approach, and the school of thought emphasizes the unconscious mind on behavior. So Freud believed that the human mind was composed of three elements: the id, the ego, and the superego. What I find fascinating, once being a psych student and now an applicant of somebody who applies this, is that I find this very similar when I did my research in Islamic counseling, psychology, and theories. This was very similar to what we have when we talk about the three parts or phases of the nafs, right? So you have, of course, the nafs al-lawama, nafs al-mutma'inna, and the nafs al-ammara. This time I got all three without the Sheikh's help. I always forget, right? So these are very similar. When we look at the id, right? The id is the place where I want what I want. I'm going to go, I'm going to get what I want, do what I want. And so this is the ammara, right? And then you've got your superego, which is the lawama part, which is the gateway, sort of saying, you know, you should perhaps think about this, you know, so the gateway rather than jumping to it right away. And then you've got the ego as well, which I think I missed one of here, but the mutma'inna, where you want to go to that place of itma'innan and that serenity. So I found it was very comparable when we look at psychoanalytical elements. This is very comparable to the Islamic psychology that we have when it comes to the different phases and parts of the nafs. So moving on just quickly, so other major psychodynamic thinkers that we've probably heard of is Anna Freud, which is Dr. Sigmund Freud's daughter, Carl Jung, and Erik Erikson. And what's interesting about Carl Jung and Erik Erikson is that they developed this a lot more further and more in depth, and even moved away from the original thoughts of Sigmund Freud, which even now modern psychology refutes, because a lot of it was also based on psychosexual dynamics, which just don't really make sense according to modern psychology, perhaps, but definitely doesn't go with Islamic psychology. But a lot of the things that Carl Jung and Erik Erikson talk about, for example, I use a lot of Erik Erikson's work when it comes to child development, and I find this is very congruent, and it goes along with what we have in Islamic counseling, child development. Perhaps we can talk about that inshallah in the future, but I find they're very similar. Carl Jung talks a lot about symbolism in dreams and in the unconscious, and I find that also is very similar to our Islamic thought. So I'm just going to speed ahead here. So we have also here, so we've done already the structuralism, the behavioralism, the psychoanalytic, and now we're talking about humanistic humanistic psychology. So this is developed as a response to the psychoanalysis and behavioralism, and this is instead focused on the individual, free will, personal growth, self-actualization. And major thinkers in this line of school of thought, of course, is Abraham Maslow, when you've heard of Abraham, the Maslow hierarchy of needs, and Carl Rogers, very humanistic. This is something as a Muslim practitioner, when I need to at times, depending on my clients, I really adhere to this humanistic psychology because it is more holistic and it goes in line also with our Islamic thoughts in terms of the individual's free will, the personal growth, the self-actualization. These are very similar to our schools of thought. Then we have Gestalt Psychology, and this is based upon the idea that we experience things as unified wholes. So this approach to psychology began in Germany and Austria during the late 19th century in response to the molecular approach of structuralism. So rather than breaking down thoughts and behavior to the smallest of elements, the Gestalt psychologists believe that you must look at the whole of the experience. And according to these thinkers, the whole is greater than the sum of its parts. Some of the people that we know used this, of course, is Dr. Viktor Frankel. He used a lot of principles of Gestalt psychology, and I'll talk about him a little bit more later. He's somebody that I really followed greatly because he also did the humanistic approach and the existential, which includes spirituality. Last but not least, we have the cognitive psychology, which is a branch of psychology that studies the mental processes, including of how people think, perceive, remember, and learn. And as part of a larger field of cognitive science, this branch of psychology is related to other disciplines, including neuroscience, philosophy, linguistics. And one of the most influential theories from the school of thought was the stages of cognitive development, theory proposed by Jean Piaget. So this is a little bit of history that I was really excited to learn, relearning and remember, because this was ingrained in us from beginning of Psych 101 to even in my graduate studies. We always had to go back and learn this, just like we do in Islamic studies, learning the different schools of thoughts and the laws and everything around that. I didn't mention here as one of the schools, but we also include in humanistics the existential psychology, which includes divinity, God, spirituality, and pastoral type of psychology and counseling. And that is the school of thought that I follow, which is humanistic existential psychology with little bits from here and there. It's kind of like following a marja and then taking ideas from different places. I'm not going to get into that fully. That's not my area of expertise, but when you're comparing, it's somewhat like that in terms of understanding schools of thought and what you follow and the leaders and the researchers and the experts in each of the area. So I hope this was a somewhat comprehensive but concise introduction in terms of understanding what psychology is from.
Can I get my certificate in the mail now?
Yes, you will.
Through that whirlwind crash course.
Inshallah, inshallah. So I hope if anybody has any questions, please don't hesitate to jot them down and ask us.
Thank you both for those very eloquent introductions to the subject. Before we move forward tonight, like Sister Berak just mentioned, I wanted to remind our audience members following along with us to actively think of questions. And please feel free to ask them in the chat, and inshallah at the end, we're going to be able to get to as many of them as possible. And I wanted to probe deeper into the definition of the psyche. So my question is, what is the relation to human personality and day-to-day function?
So I guess I'm going to jump into that first, or Sheikh, now you're going to do it first.
Please go ahead, Sister Berak.
So when we take a look at human personality, it's important to understand what personality is. I know we have an essential idea of it when we look at each other, how different we behave, how different we interact with each other, and so on and so forth. But it's always good to understand the definition of it. And it essentially refers to the individual differences in characteristic patterns of thinking, of feeling, and behaving. And so there's two broad areas of study when we look at personality. So one is understanding the individual differences in particular personality characters, such as sociability or irritability, right? So these are things that we see often with people, right? When we're thinking about day to day, is you see how they behave, their characteristics, and the other is understanding how the various parts of the person come together as a whole. So that idea of the Gestalt, like we said, right? So essentially, there's also personality disorders, right? Some people have different disorders and so many different types. I'm sure you've heard of the Myers-Briggs personality types, where there's 16 combined types of personalities. So it crosses between understanding differences with extroverts and introverts. If you're in how you take in information about the world through the senses, right? Or through intuition, or if you're a thinker or a feeler, or if you're a judger or a perceiver. So the combination of that gives us 16. And within these personality types, you have different names like the commander, the leader, the advocator, and so on and so forth. So it's fascinating studies of that. But essentially, you do have different 4 different personality types that psychology suggests. So the sanguine, the choleric, the melancholic, and the phlegmatic. So these are harsh, big definitions, you could say, right? But essentially, we can characterize ourselves according to that. Now that we have a better idea of the definition, let's look at how, let's say, this human personality in terms of day-to-day function. Well, sometimes you have these different types of personalities that clash, right? That just don't work together. The type A's, that you've heard of that also. There's so many different names for them, right? So the type A is the one that's very high strung, very high achieving, has to be very perfect, has to achieve perfection in marks and events and so on and so forth. And sometimes this person can be great as a leader to get things done, but perhaps not necessarily the greater personality as a leader in terms of the interpersonal aspect of encouraging and motivating people, especially if you have different personality types, different levels, different potentials of people, right? So you have all these different types of personalities where day to day you can either clash or you can get along. It becomes an issue per se when it's a disorder. Some of the most common personality disorders, which I'm sure you've heard of, are the narcissistic personality disorder, the borderline personality disorder type, bipolar, which can be also considered a mental illness at times. So these are disorders that happen from a variety of things. For example, genetic hereditary factors, right? Could be also the environment, and also not to mention there could be a chemical imbalance that's involved, which is why sometimes it's completely out of their hands, right? Where medication is needed, where treatment is needed, and a variety of different schools of thought that we looked at, and their behavior, or rather their treatment strategies can be applied to helping this person manage their personality quirks, I guess you could say, that could probably conflict with other people. What's really challenging about these disorders is that the person, for example, such as the narcissistic type, will not see themselves as somebody who has an issue, and it becomes really hard to deal with this person. And I'm sure you have seen these people at work, in the workplace, and it becomes even harder to deal with when you have to live with them at home, because it's hard to connect with them, especially let's say if they're a parental figure or a partner, and it can borderline go on abuse as well, right? And we've seen a lot of abusive situations where either the female or the male exhibit these types of personality types, and it becomes really hard to cope and deal and really treat and save and help the family, right? We do see that people who come, and I see this in the clinic often where I work, that they come and identify, say, I think I might have some of these traits. I think I tend to lean towards, days where I'm really high up there when you're on that hyperactive high of the bipolar, and then sometimes you're on that low of the bipolar where you're very depressed and exhibit all the symptoms of depression. So they say, I recognize this in myself, and it's really hard for people around them as well, because they're up and down all over the place. And it essentially, and I'm using this word loosely, and I've heard that how people use it, makes them look crazy, between quotes, that this is how they're behaving. But the thing is, they don't understand the personality disorder, right? I've also had people come and tell me, I think I might have BPD, borderline personality, which also exhibits similarities to bipolar, right? You've got the highs and lows, but it also exhibits such things such as addictions, the neediness. Almost, there's a book that's out there that's called I Hate You, Don't Leave Me, and it shows you, like, I hate you pushing away, but also don't leave me. And that they can be suicidal as well. They could be promiscuous. They could be addictive. It's a very strange disorder that sometimes we don't recognize, and sometimes people could be living with somebody for years and labeling them as abusive when it could be this disorder. So day to day, these are extremes that I am describing that are, although they are extremes, they are quite common these days. We see so much of the narcissist personality in people, whether they're in positions of power, whether they are in our communities, whether they are in positions of power, like we said, right? They exhibit some of this. And I hear this a lot from men and women in the communities, every city that I go to and each center that I work with, I hear this kind of feedback from people that say, you know, so-and-so or such and such, we notice this. And because of my training for the years now of recognizing, but not diagnosing, assessing and recognizing is different than getting an actual diagnosis from a professional. I see that there are these different personality types that can clash when they are in positions of power. They are hurting people. They're not aware of what they are doing. It becomes really hard to deal with. So day to day, you know, you've got sometimes issues with your siblings. You just rub each other the wrong way sometimes, and it could be because of personality. That's normal. That's common. You have that with your spouses as well. It becomes an issue, like I said, when we get into the disorders, when it gets to abuse, when it comes to people in positions of power who do not respect the positions that they are in, and then you see the personality disorder come through.
Thank you, Sister Berak. I'm going to take one more step deeper, and I'm going to ask you, what is the relation between reasoning, the mind, and cognition? And how do these facilities interact with each other?
Am I going to answer this first, or is the Sheikh going to answer the personality before we jump into this? Because they're not very connected right now.
You can answer this one, then we'll move on to Dr. Sheikh.
Okay, so when we take a look at what is the relation amongst reasoning, the mind, and the cognition, to the layperson, we use these words possibly very interchangeably. I'm guilty of that too. And when I was thinking about this question, said, you know, maybe we need to look at them separately before we look at the relation. So let's look at definitions again. I seem to be like an encyclopedia or a dictionary today. Good thing I did my research ahead of time, right? So when we take a look at the word reasoning, the definition for that is the action of thinking about something in a logical, sensible way. That makes sense, right? Mind, the definition for that is the element of the person that enables them to be aware of the world and their experiences, to think and to feel. It is the faculty of consciousness, awareness, and thought. Cognition is the mental action or process of acquiring knowledge and understanding through thought, experience, and the senses. So now that we've seen what the definition and the meaning is for each one, how do these facilities interact with each other? Well, absolutely, they are all interlinked. You need to have the mind, right, the aware mind, to be able to do the action of thinking in a logical, sensible way, hence the reasoning, right? And you need to have the mental process or ability to acquire that knowledge, the cognition, to understand this thought process, right? So they're all interacting with each other. So this is from the psych perspective. And I know from an Islamic perspective, as our respected Sheikh already mentioned, there's tons of references back to the aql and reason and these definitions here from an Islamic perspective. So I bring this back to the Sheikh in terms of both this discussion in terms of reason, mind, and cognition, as well as personality.
Thank you. So I'm learning as I go along as well. And from the perspective of reasoning and a human personality, I think it's important to consider the creation that Allah subhanahu wa ta'ala has made. And from the perspective of a scientist, which is what I am, and a neurophysiologist on top of it, we know that a human being, any human being, is going to be the product or the result of their genes. So those genes are what they have derived or they have acquired from each of their parents. And that's why Islam stresses very importantly that ensure that when you get married and you have children, that you are choosing suitable spouses, suitable companions for each other. And that you're doing so with the thought in mind that when I have progeny, when I have children, that those children are going to have the best of qualities. And I would be remiss if I did not mention today the birthday of Imam Ali alayhi salatu wassalam. and the example of Sayyida al-Baneen, who was a source of courage and a source of valor that passed into her sons and was so evident in the struggle at Karbala. And so genes are what are going to determine who we are from the most basic sense, but then how we live, what we're exposed to, and certainly how we interact with others and the types of things we consume are going to determine not only what we become, but certainly how we respond and react to the world around us. And our upbringing has a lot to do with it. That's why Islam emphasizes tarbiyah. Now, the goal of what we're doing here tonight is to talk about the mind and the development of that mind. And not only the development of that mind, but what role does that mind play in determining the world around us? And I think part of the issue here is that we do not see the mind as being this physical component of the human being. So for example, if somebody has a problem with their stomach, somebody has heart disease, somebody has developed cirrhosis of the liver, they will go to the experts in that field, the physicians, and they will get that treated. Why? Because there is a physical target that can be honed in on and treated with the appropriate types of medication or interventions. But in the case of the mind, where do you localize the deficit? Or where do you localize the problem or the disease or whatever that's happening that's aberrant and that's causing dysfunction in a person's life? And yet we know that that mind not only drives the physical aspects of the body, but it also is affected by this physical body. So let me give you guys two really nice examples, all right? And tell me if you actually go through this yourselves and be honest. There is this phenomenon, and Sister Berak, I'm sure you know this better than I do. It's called licensing. All right. So I love to play soccer. I play a lot of soccer. I also do a lot of long distance running. And when I do that running and I play my soccer, especially when I've done a 90-minute game, I'll come home and I will feel justified about having a big piece of pecan pie. I'll feel that I physically have done what I needed to do that would allow me to go ahead and eat that pecan pie, as horrible as it is for my health with all the sugar and the fat, all of that's in there. But my mind will tell me that that's okay. My mind will justify for me that you went and you did something difficult. You worked hard physically. You did what you needed to maintain the health of your body. Now you can go ahead and splurge a little bit. It's so much so that when we practice this, we do it subconsciously without thinking. And that's because, again, the mind is determined by a lot of what is the body is encountering. On the other hand, let's look at it a different way, all right? There is a very nice condition that we know about in sort of the cardiovascular diseases. It's called Takotsubo cardiopathy, all right, or cardiomyopathy. Takotsubo cardiomyopathy. Go look it up. It's really interesting. And what it is it's called heartbreak disease or heartbreak cardiac effects, all right? And what ends up happening, and you'll find that this happens in primarily women who are over the age of 50, that they will go and they will encounter or they will experience some really stressful events. And that stressful event could be, God forbid, the loss of a loved one. It could be divorce. It could be a major career setback, but something that causes a severe emotional upheaval inside of this person, all right? So something that's targeted the mind. Now, what happens to them? This condition, Takotsubo cardiomyopathy, basically creates the symptoms as if the person is having a heart attack. So this person will start to experience chest tightness. They'll start to experience faintness. They will feel like they're having a heart attack, and they will race to the emergency room. And they will see that once they do the standard ECG and they run the panels and they look at their troponin levels and all of the other markers of heart disease, they will find that nothing had happened. There was no constriction of the artery in the heart.
Sorry, Sheikh, it sounds like you're also describing something like a panic attack and an anxiety attack.
Yeah, so in this case, it's sort of similar to that, but they are very key to mention that this is different from an anxiety attack because the symptoms mimic a heart attack. the chest tightness that you would feel in a heart attack, that's what they're experiencing. But the only reason it's happening is because they're having this emotional upheaval. They have no reason, they have no risk for heart attack. They don't have heart disease. They don't have hypertension necessarily, but it could just be that this emotional flood that starts in their mind releases adrenaline, causes the neurons or the nervous system that controls their heart to become hyperactive. And that causes this severe pain in their heart. And they feel like they're having a heart attack. And really, the etiology of this sort of a condition is not really known. We don't know why it happens, but it's fairly well documented. But it points to the fact that the mind is so intimately connected with the physical body that when you talk about it, now I'll say this from the Islamic perspective, and again, asking our viewers to fully recognize what we're trying to say here, or what is being sort of suggested here, is that just like you deal with the physical body as the target of some sort of insult or a piece of the body that can become damaged or that can become dysfunctional or that has some deficiency in it, the mind is essentially the same way. And there is enough data and enough science that indicates the connection between the body and the mind is so intimate that to be able to address many of these physical concerns, you also have to look at the mind. You also have to look at the function of the mind and what the mind is being exposed to. So that's sort of the thought process. And there is nothing objectionable to this in Islam, because Islam addresses the aql, the mind of a human being, and does so for the basic actions that you carry out on a day-to-day basis.
Right. Complement each other, really.
Yeah, definitely complement each other and show that when the body is tired, the mind can also be tired. And when the mind is tired, the body can also be tired. And that it is not so simple as to say we're going to disconnect the two.
No, that would require some serious severing with the surgical knife, right? It's all interlinked.
I've already looked into having my brain preserved after I go from this world, and the results are not good.
And you know what I'm going to cheekily ask right now? Is it halal to do that, to preserve organs?
I will not answer that question. I am not in a position of authority to do that.
You set yourself up, Sheikh, now with that comment.
I just said I investigated it. I looked into it. I didn't say anything else.
Thank you both. It's great to fit the psychological and Islamic pieces together so smoothly to create a more holistic picture. And my next question for Dr. Sheikh, how does the Holy Quran and Hadith address mental deficits? Are there any examples in the Quran and Hadith literature that explain the mental state?
Thank you, Melanie. So I'm going to get into this part in a fairly rudimentary manner. And I think this is the main topic that we want to address today. And if the viewers, our respected brothers and sisters who are participating have questions, this is the time and this is the place where we need to really think about what we believe in and what Islam says and what Islam does not say. You all know very well that when Prophet Muhammad sallallahu alaihi wasallam started to proclaim his message, and this goes for all of the prophets, all of the messengers, that the people around them who did not want to believe wanted to find any reason why their message could be invalidated or could be considered to be frivolous. And so what they did was they called Prophet Muhammad sallallahu alaihi wa alihi a majnoon. And the Quran says it, that he was crazy, he was a madman. And hence ascribing what to him? That the words that were coming out of his mouth, the things he was telling people to do, were absolutely nonsensical, that they were not based in reasoning or anything that was real or based in reality for that matter. So we know that this contention exists. The Quran addresses the fact that there is a condition that can be ascribed to people, obviously not to our beloved Prophet sallallahu alaihi wa alihi, but that can represent the mind not being in the right state or not having the type of sanity that would be considered to be healthy, quote unquote. So that's from one perspective. We know that it exists. Quran talks about it. The other thing to talk about is the fact that the mind has been described in the fiqh quite a bit. So you know that, for example, when you go to worship, you must be in a state of sanity, meaning one, you should be conscious. Number two, obviously, wal-'ayadu billah, you cannot be drunk or intoxicated. But number three, you should be of right mind. You should be sane. Now, when you say that the person is aqil, when the fiqh talks about someone being aqil, it is suggesting, and again, take this in a very simplistic manner that I am explaining it. The fuqaha are the ones who will give you the deep meaning and the deep understanding of this. But it means that somebody knows what is required of them. They know the information that they acquire, and they know what they are obliged to do, meaning they understand what is proper and not proper. For example, they are not somebody who will go and put their hand in a burning fire. They were not, because they know that will burn them. They are not the type of person who will go and speak nonsense without even realizing it. They will not speak words that have no meaning to them. They are the people who understand the world around them, the stimuli that they receive, and the obligation that is placed upon them by Allah subhanahu wa ta'ala. That's why even Samahat al-Sayyid al-Sistani, may Allah preserve his life, he says, and this is quite well known, that if a person is not sane, they do not have sanity, and let's say the month of Ramadan comes, and they are still in that state where they are not sane through the whole month of Ramadan, and they do not fast, then they are not obliged to make up those fasts. Why? Because they did not have sanity in that entire month of Ramadan. And so having sanity is a very important component of what it means to be a believer, a worshiper, and to be able to properly enact that worship. Now, why is that? Well, because everything is based in our understanding of who we are with respect to Allah subhanahu wa ta'ala. And not only with respect to Allah subhanahu wa ta'ala, but in terms of the conscious steps we take in our worship. Now, how do you then differentiate those people who, as many of the traditions say, are majnoon, and those people who are not majnoon or who have a different issue? There is a tradition, and I will state this tradition and I will end, that states that some people came to Rasulullah sallallahu alayhi wa alihi wasallam. In fact, Rasul saw that they were looking at another individual who was standing there and was acting strangely, it is reported. And he was acting strangely. Rasulullah came upon them. They said, Rasulullah, this man, he is insane. He is acting like an insane human being. He's saying things that don't make sense. He's acting bewildered. He does not demonstrate any sanity. So they came to Rasulullah. Rasulullah looked at him, and Rasulullah sallallahu alayhi wa alihi wasallam, in the hadith, it says, he says, this person is not majnoon. They are not insane. He said they are mubtala. He says, these are people who are afflicted. He is a person who is afflicted with some condition, possibly. And the majnoon, in fact, Rasul answers now, is someone who spiritually and in the obedience to God is completely deficient. So explaining that the mental health deficiency that was in this individual, the inability to properly function or to process information, was an affliction that had got him somehow or had afflicted him somehow. And hence the suggestion that there should be a treatment for this. And that is the interesting thing that we should consider, that Islam clearly says that there are conditions that will afflict the body, you should get them treated, but also consider the effects on the mind and how that mind is going to be affected by the world around you. And clearly the fiqh very, very pointedly delineates what it means to be someone who has lost their sanity and has developed mental inability or mental dysfunction. And I apologize if I am not using the right terms. And the difference between someone who is of right mind, has reasoning, but chooses to disobey God. And that's what the Quranic or the Islamic tradition point towards and try to clarify. Yeah.
Thank you, Dr. Sheikh. I'm very excited to ask this next question. First, I'm going to ask.
Before you do, sister, sorry, can I just wanted to add a comment. As you were describing all of the Sheikh, now I could not help but go back and remember the stories of how the Prophet and the Ahlul Bayt alayhimus salam exhibited kindness and compassion to those who were vulnerable in our societies back then, and how when we talk about stigma of mental health today, how there isn't that attitude towards those who are dealing with mental health issues. There's judgment and isolating and fear, whereas you see the embodiments of what the Ahlul Bayt showed was to show compassion and not judge, and embrace and bring those who are vulnerable in our communities closer. So it's so interesting to see the story that you described, but also the fi'l, the action of what the Ahlul Bayt and the Prophet exemplified with their compassion to the vulnerable. And that's something I always tell our communities, that we're missing that contributes to the stigma and the alienation of people who are struggling in our communities.
So can I'll piggyback onto that, Sister Berak. And again, I'm not an expert in this field, but you mentioned so nicely the cognitive behavioral therapy that is used oftentimes by psychologists today. And just from my rudimentary reading of it, it was just my understanding, and you can correct me if I'm wrong, is that the professional, the therapist or the psychologist who is administering these sessions of cognitive behavioral therapy, they seek to find out the negative or the destructive ways of thinking, or the negative patterns of thinking that cause someone to spiral to a bad place. Mm-hmm. That to me, if I were to say to you that someone, and oftentimes people do, and they come to the mashayikh, they come to the scholars and the sada, and they ask them, they say, I have this trouble with this issue. I have this uncontrollable anger, or there is something in my life like the Ottawa Senators that just drives me nuts, and I get really enraged and I can't take it.
Wow.
And I go nuts.
You just have to go there every time, huh?
Every time. All right, I'll start picking on something else altogether now.
That's okay.
So there are these triggers that cause me, and as a scholar, you will sit there and you will try to say, well, what triggers it? What caused you to get to this state? Do you have some form of PTSD? Is there, God forbid, some violence in your past, or something that you've experienced because of which you are now having these issues, these behavioral issues, these psychological issues? Is that any different from the physical body? That, for example, you smoked for 20 years and now you have lung disease and you need treatment? It's an exposure. It's just that I think our people, Muslims in this case, think that exposure to the mind is not really an exposure, and that deficits of the mind are because the person, for some reason or other, has done something wrong, God forbid. And it's not necessarily that way. It definitely is not, because we are exposed to so much, sometimes of our own volition and our own doing, but sometimes because of circumstances. PTSD is a well-documented condition where you see people who've come from war zones, and any little sound will startle them. Can we say that their minds are not like needing of treatment and needing of care? Sorry, I jumped in.
No, that's beautiful what you were saying. And as you were describing that, I remembered a few clients that I had who were dealing with PTSD from war, sexual assaults and war zones, and how they would respond when they would see military personnel out the window, how they responded to it. Does that mean that this person, like you're describing, there's something wrong with them? No, I would say this requires a lot more compassion to give to this person for what they've been through, that exposure and that trauma. And when they see something that reminds them with their mind, even their unconscious and the subconscious, even if they're not aware of it, that they can be triggered and they will respond in anger. They will respond in anxiety. They will respond in fear. SubhanAllah, how the mind was able to capture and keep in memory in the back from what happened before, whether it's early childhood or previous memories. And the mind protects by almost blocking the memory for a while to survive. And then when people are outside of that survival zone, what happens is when they see something that re-triggers that memory, they will respond in such a way that those around us will probably deem as strange or unfit, or there's something wrong with them, right? And definitely with CBT, that's one of my favorite forms of therapy that I've been trained in, and I like to administer that. And it works beautiful beautifully with trauma, because you are looking at a past memory with a behavior or a thought, right? And this thought, and this is your area, Sheikhna, in terms of the brain and the neuroplasticity and so on and so forth. I think we mentioned this before in our previous session, so I won't get into it too much here. But essentially here, the more you talk about this and the more you're exposed to this memory, the more traumatic it can be. And what we want to do is sever the ties or reduce the intensity of that memory to the trigger. And so this is where CBT comes in, where you work on the thought, work on the memory by not necessarily talking about it over and over again, but giving compassion. For example, the person who is reliving, go back to your younger self, go back to your past self. What would you tell that self? What would you give that self? Most of the time it wants comfort, reassurance that they're going to survive, they're going to be okay, they're going to be accepted, they're not going to be rejected. And so that present person can go back in time, give that to that past person. It won't change the circumstances that were out of their control, but it will definitely change the way they look at it. And this is where you reduce the intensity and the strength of the memory and the neurons that are attached to this trigger. It's fascinating, right? When you describe it this way, it just makes sense, right? And I find it fascinating personally because I've seen it in play with clients who've had major trauma, who've had difficulties, whether it's, like we mentioned, sexual assault or war, and so on and so forth. So much they've seen, or even bullying, which is very common. And when you work on it, it takes a while, of course. It's a long-term type of therapy, but it's so powerful. And especially for those who are not believers, when you see it and when you look at the science and the research behind these strategies and how they work, and the books and books that we have on them, and the trainings that we get, it's amazing how what could work for one person may not necessarily work for another person, right? Because there's so many different factors. Like you said, Sheikhna, the environment, the genetics, the social upbringing, nurture versus nature, the hereditary, everything, all of this all together. There's no cookie cutter approach. It's a trial and error. We have to figure out.
Yeah, so can I ask you a question? Whenever I think of it this way, just to keep this conversation going, and sorry, Melanie, I know we have an agenda, but I thought we're on a roll. But I had a thought, and I want to ask this of you, Sister Berak, that just as you would go to a doctor, a heart doctor, or let's say a GI specialist or an eye, nose, ear specialist, and you're complaining of something that's happening to you, you've got pain somewhere, but you don't know what's causing it. And you go to them, and they apply their expertise. And in this case, they are known as Ahl al-Khibra. They have experience, they have expertise in this matter. They have knowledge about this matter, that they've studied it. They know the effects of certain things on the body. They know the symptomatology, and they're able to tell you based on the tests they run or what they perceive from you that this and this is wrong with you. In your training, do you have the same sort of thing where we could say that you can find the indicators, or you can find the triggers or the causes behind something and unravel sort of the mystery behind the conditions that we are seeing, such that a therapist, a psychotherapist, a psychologist could be then considered Ahl al-Khibra for this sort of a thing?
Well, why wouldn't they be? I mean, any expert that you have that has been trained, that has degrees in the area. I'm not talking about like a 6-week course and all of a sudden you're calling yourself an expert, right? I'm talking about years of educational training that you have to read and tests and exams. And then you've got also the regulatory bodies that you go into, and there's a liability and ethical and moral liabilities, and to upkeep that training and knowledge as well. Like, you don't just get that and that's it. Why wouldn't they be called Ahl al-Khibra, right? Ask those who know, right? So we will always want to ask those who are trained in their area. Like, for example, if I wanted to learn more about your area of expertise, am I going to go talk to a cardiologist? Probably not. I will talk to somebody with your knowledge and training in that background. Why wouldn't they be called Ahl al-Khibra, right? And I'm very careful to use this title because, like I was saying, there's a lot now, especially in the pandemic, we've seen this rise over the last year, where there are people who just have, who've gone through stuff themselves and all of a sudden felt they want to help people and have gone off and gotten the 6-week course on life coaching, transformational life coaching, or whatever you want to call it. And then all of a sudden are senior life coaches and putting on these programs and paradigms and giving coaching lessons to people to transform, and when there are mental health issues involved, that is something that is very concerning as an expert in the field. And I've spoken to many mental health professionals in the field who find this very concerning, because when we're talking about mental health, you are dealing with somebody's life just as though you are dealing with somebody who is a cardiac, I guess, patient, right? You're dealing with the sensitivity and the vulnerability of the mind and the soul and the spirit here. Somebody's fragility, right, is in your hands. And if you don't have the appropriate training and liability, do you know how much liability insurance is on our heads? If that is not behind us, of course, we can't call ourselves experts. And even myself, I shy away from that. Sure, I have a number of years under my belt and I'm under a regulatory body. I'm still learning like all of us, right? And sometimes I have clients where it just doesn't work. The session doesn't work, right? So then, or the therapy doesn't work. So then I make sure to go ask those who know. I will ask my superiors. I will ask people in different disciplines of psychology, whether it's a psychiatrist, whether it's a specialist such as a psychologist in whatever field, whether it's anxiety, post-traumatic stress, or ADHD, right? So we have to be careful when we call ourselves Ahl al-Khibra, or if other people put that title on us, you better have earned that. And even then we are still learning and growing, just like I hear from my brothers and sisters who are studying in the house and they've accomplished, 10 years, and they humbly still say, we're still learning. There's still so much, we're babies in this field compared to people who are 40, 50 years of studying. So it's same thing in our field, but I would say it's more practical, right? In the sense that you are being trained in CBT, you are being trained in rapid eye movement type of therapy, mindfulness. So there's so many different practices that we can be trained in that you can apply. But if you don't have that certification for that training, but behind you, the degree and the regulatory body, you're not Ahl al-Khibra. You're just somebody perhaps who's gone through the world experience that you have. And I'm not saying life experience is not valuable. It is absolutely valuable. And I've seen so many amazing people with no degrees or no regulatory bodies or whatever you want to call it, who've been the most amazing of supporters and helpers and inspirational motivators. Absolutely. But that's different than when you're talking about treatment. That's different when you're talking about healing.
Again? I'm sorry, again, I cut you off, but you keep saying,
no apologies.
I feel like I want to follow up with. So if you, based on what you just said, the goal is to make somebody functional, right?
Yes.
The goal is to take somebody who cannot function for some reason, or is experiencing obstacles or dark moments, let's say, in their lives that they cannot overcome, and you want to bring them to the other side. You want to bring them back to well-being. You want to bring them back to health and positivity and functionality. So why might a person like me not be able to do that? And I'm not trying to put you on the spot. I think the black and white, most blunt answer is the one, because I'll tell you this frankly, that I've received calls. I'm sure every other scholar has received calls where someone in the community will say, we have such and such person, or there's a person who is hearing voices, God forbid, and this is hypothetical, I'm not mentioning anyone, or is having thoughts of suicide, God forbid, or these sorts of things. Can you talk to them? And my first feeling is that I am not equipped to deal with this. I do not have the skills to talk to them. I don't have the ability to understand what processes are making them go through this. And so the question again to you is, why would a person like me take on something like this? Or why is this not something that I should be doing?
The sheikhs and the scholars, God bless them, in our communities are what I call the frontline workers in our communities. They are the go-to when there's a family problem. They are the go-to when somebody behaves strangely, the way you described it. And I've seen this over the years in my own community here in Ottawa. They are the first ones to get the calls. However, are they trained in diagnosing and assessing and treating? We all know that most are not, unless they have a degree in psychology and clinical psychology, psychiatry, psychotherapy. Most won't. Some will have perhaps some counseling skills for marriage counseling and so on and so forth, right? And I recall even here in my own community one time where there was a young man, and we've heard this story again and again in our communities. It's not just here, where he was hearing voices and he was behaving very strangely. Right away, the families assumed that he was possessed by jinn. And so they called the sheikh, who did what he could initially, because that was the initial assessment that he did, that based on what the family said. And this young boy was not getting treated or healed, to which the Sheikh, and he was very open-minded, said, take him to the emergency, take him to the hospital, he needs psychiatric assessment. I have done everything that I can. Take him over there. To which then the hospitals took over, assessed, provided medication. The young boy was dealing with schizophrenia. It was not because he was possessed by jinn. But that's essentially the first line of thinking that we will have in our community. And mind you, like I said, we know that there are scholars and sheikhs who have taken on psychological studies, are getting training, and this is something in line of what we want to be doing, inshallah, in the future as well, to work hand in hand to make sure that our amazing frontline workers in our communities, the sheikhs and the scholars, for those who want, of course, have this appropriate training so that they can be more, let's say, impactful in this area to help people and know where to refer. This is the key thing. Like when people ask me Islamic questions, I don't know why they think I'm an Islamic scholar when I'm specifically, you know, counseling or psychology. And I immediately send questions to the scholars that I speak with or that I connect with. And I'm like, I'm not fit to answer this. If it's related to my line of work, I will then refer to people because I can't take on. So you see how that works, is that sure, you can be somebody who's in front of the people in your community, but if you don't have the correct training, when you have severe cases like this, are you going to be able to? Here's a secret. I can't even do that. If I have somebody who is hearing voices and so on and so forth, as a psychotherapist, I don't have the ability to treat that. Because I'm very lucky that I work in a medical clinic, I immediately make the referral to see a medical doctor who then refers to a psychiatrist, because even the medical doctor can't treat that. We all have our own specialties and training, right? It's the same thing when we talk about the medical field. If you have a toothache, you're going to go see a dentist or a cardiologist. So same thing when it comes to this area. When it comes to, that's because you are a Toronto Maple Leafs fan, and that's why you answer that way. So back quickly to this this really fascinating question to help dispel from perhaps from our communities. It's amazing, and it's great that you feel safe to go to our frontline workers in our communities, the sheikhs and scholars, but also don't dispel the fact that you may need to be seen by a mental health professional, right? Working hand in hand. And for those sheikhs who, I've heard horror stories where they've taken on the cases and it's gotten worse because it was a medical issue. And this is to answer the first part of your question. That is not to say that the sheikhs can and have and will possibly help people who are in trouble, meaning, let's say there are marital issues, right? We know a lot of the sheikhs who conduct marriages nowadays are doing the premarital counseling, right? Which becomes really handy when it comes to, let's say, when there's been marital conflict, right? These are essential skills that most probably don't have, but realize that it's important in their line of work because they become marriage counselors of the community, right? So it's really important to recognize who to go to, who you can trust. If you find that, you know, you need to talk to a sheikh because there's spiritual issues, absolutely. But then if you're hearing voices, or you know somebody who is hearing voices and the sheikh cannot help with the spiritual healing, then absolutely you go to the medical experts to help with that, because it could be worse than that. Quickly back to that, when I mentioned earlier, just because somebody doesn't have a degree or is under a regulatory body, it does not mean that they cannot inspire and motivate and help people. Absolutely, you see so many great people out there with life experience that have so much to share and empower people. Why not? But when it comes to actual treatment, you would not go to a dental hygienist to get a root canal. You go to the dentist. Same thing here.
I think in addition to that, it's the part that becomes challenging for most people, most ordinary people, is how do you determine what is considered to be pathological and permanent, or at least long-term, as it might be the case with schizophrenia or long-term depression or bipolar disorder or something, and I'm just throwing them out, versus something that is just a temporary condition due to something that has happened in life, due to a loss. And again, I think you said it really well, that the suggestion is not that if you have some emotional or mental or psychological upheaval in your life that you should not go to the Sheikh or the Sayyid. No, of course. But I think what needs to happen is there's got to be better education to teach people when the time comes for you to get professional help for something that is chronic, something that cannot be treated with quote unquote spiritual treatment. And I think that's what needs clarification, particularly for our communities.
Absolutely, absolutely. It's the same analogy I use when describing when you break an arm or a leg, right? Who do you go? You're going to go talk to a sheikh like, hey, sheikh, I broke my arm. Can you help me? Really? Sure, he'll make dua for you, which can help you perhaps hear a little bit. But the pain, you're going to need some morphine, right? You're going to need that cast. You're going to need the x-ray before you talk about that. Just like the diabetic as well, right? This is a genetic issue, perhaps the lifestyle issue, et cetera, that is compounded. And then you are all of a sudden your insulin levels are low and high, your glucose levels, right? And so what happens here is that you need to take your insulin shot. Lifestyle changes as well, right? This becomes a chronic lifetime issue that most people have to deal with depending on what type of diabetes and every factor around you. I've heard of people who eventually over time, because they've corrected their lifestyle, they've been consistent with their treatment over a long period of time, eventually they came back to normal. They were able to regulate their insulin levels. They didn't need it anymore, right? I hear this from people as well who take medication. What happens here with depression, for example, or anxiety, they're so fearful of taking the medication because they're going to become addicted to it or rely on it when they feel they should be relying on Allah subhanahu wa ta'ala. Well, let me put this back in this perspective. Did Allah not create the men and women and the scientists and the research to come up with a medication to help you deal with this? Just like it was for pain medication or diabetics, right? So same thing when it comes to mental health and taking the proper medication as well, but it's not just popping those pills. There's the lifestyle changes as well. There's the toxic environment around you, right? These are crucial to having the stability and consistency, and of course, taking medication, right? And I've seen people where they take it just for a certain amount of time. Of course, there's some side effects, and when you first started, and then when later on withdrawal, when you slowly wean off of it and you're being monitored for a certain amount of time. And I've seen it just temporarily for people, and other people, just like the case of the diabetic, it would be much longer, if not a lifelong thing. It's all how you choose to manage it in your lifestyle.
Thank you both for that discussion. It brought up a lot of interesting questions that we should definitely keep in mind going forward. But just to sort of move our discussion back towards the topic of compatibility with mental health in Islam, I was thinking of our different societies and communities. We hold so many different stereotypes towards mental health and when to seek help. For example, I've heard so many times before about how we say to each other, just make dua or read Quran, you don't need anything else. And this sort of perception, it negates the mental state altogether and places mental health and Islam on two opposite ends of the spectrum and completely incompatible with each other. So my question, I guess I'll direct it at Sister Rock first, is are there any glaring contradictions between mainstream mental health clinical practice and Islam?
So there's not a yes or no to this answer. I think with everything that we have said so far, it could be summarized in this answer, so to speak here. There are some conflicting ideas from different schools of thought, just like we have in the different schools of thought from the Islamic schools of thought, right? So I use that to compare here. So here, there are some conflicting perhaps ideas even within general psychology with these ideas. As you saw, the behaviorals came as a response to the structuralists, and this came as a response to that. So they conflict amongst each other. So there are going to be some ideas that perhaps are not congruent or compatible with our Islamic ideas. We don't have to follow them. Doesn't mean we have to follow them. You can learn about it, right? You can read about it. You can debate about it. You don't have to follow it. You're free to choose that. When it comes to treatment, of course, you have to do the research to find what is the compatible one. So for example, you can find somebody who's not a Muslim, who is a therapist and perhaps doesn't provide the therapy for a Muslim client, so to speak, or patient. Doesn't mean that they're not going to provide the appropriate therapy for them, right? Perhaps they are trained in cultural and faith-based counseling treatments, which would be just as fine for somebody who is of Muslim background, right? And this is what I've seen in my research, is that sometimes the Muslim or faith-based client may not seek somebody with a non-Muslim background because they're going to say they're going to influence me with Western ideas. I hear this often with parents, by the way, who are afraid of taking their kids to see a counselor, or perhaps Children's Aid Society who take the kids away. You know, there's all these misconceptions. I'm here to tell you, as a therapist in the field, that is not the case. You are always going to find somebody who's going to have a different or conflicting thought than your own. I mean, you can have that with a doctor, you can have that with a lawyer, you can have that with a plumber, right? You can have that with anybody, hairdresser. So anybody who's providing a service, you may not agree with the way that they do things. Same thing when it comes to here, the mental health, the clinical aspect of it, right? So if you find something that goes against your beliefs as a Muslim, you don't have to go to see that therapist. You can find somebody who either has faith-based training or cultural training that works with that, right? Funny enough, I see a lot of Muslims who prefer non-Muslim counselor, and it has to do with the stigma and fear of them finding out all the things that they've done that are haram, perhaps, or confidentiality. That's a big one as well, right? Perhaps people don't feel comfortable going to somebody within their own communities and backgrounds for fear of lack of confidentiality, right? So you see, you start off with that question, Sister Melanie, but then to answer it, you get into these different ideas because it's not so much glaring contradictions. I mean, we can even get into in terms of lifestyle choices that people make, if you know what I'm hinting here at, right? This doesn't go with our beliefs, but it doesn't necessarily mean that we're going to reject people from having the safe space to talk about something, even if we don't agree with it. Even as therapists, I have had many, many clients of different backgrounds, Muslim, non-Muslim, you name it, who come in with lifestyles that as a Muslim, I am not going to, it just doesn't go with a Muslim lifestyle. But I'm not there to judge. I'm there to treat them with the issue that they have come in for in a non-judgmental space, whether it's something I agree with it or not. You cannot impose your religion or your faith. Same thing when it comes to this mainstream mental health clinical practice. If it's not something that you believe in, it doesn't work with your family values and so on and so forth, you don't have to go to this therapist. Find somebody that works with your own. Now, this also begs the question, well, we don't agree with that, so we're not going to get any treatment. That's going to harm you, your child, or whomever, perhaps, if you're completely cutting it off thinking that this is completely against our religion. No, I just outlined that, yes, there are different schools of thoughts. There's different forms of therapy. Even the person that you get may be very different than your line of thinking. It doesn't mean that you're not going to go seek medical help from a doctor because their lifestyle is different than yours, right? If they're the expert in the field and they can help you, you're not going to deny yourself of that, right? So it comes down to answering it that way. Funny enough, always whenever I have Muslim clients pre-pandemic, when they come into the waiting room and then I come out and obviously I'm wearing hijab, and then they see me in their Muslim background and they are just horrified having to come into my office and having to share all the haram stuff that they have done, you know? So we provide a safe space for them where we're talking about the issue. I'm not here to judge, regardless of anything that you've done. And I find as the discussion goes with these types of clients who are afraid of mainstream or afraid of, you know, somebody of a Muslim background providing treatment for them, is that that's cast aside, alhamdulillah, because what we're doing is, or non-Muslims who come and see obviously ethnic minority and a female with a hijab, visible faith, perhaps the prejudice there or the misconceptions. And as soon as I speak like a Canadian, that's gone, even though I live in Ottawa and have Sens fans here, you know. That's put aside because then they see the professional, they see that we're here supporting them, there's no judgment, we're here to help them solve the issue, whether it's academic, emotional, financial, whatever the case is. In most cases, what I've seen with Muslims, they come back at the end near the session and say when they felt comfortable and supported that, you know, I've stopped praying. You know, I'd really like to get back into that. You know, I used to wear the hijab, you know, that kind of discussion. And I love that because this proves that although, you know, we're doing mainstream clinical counseling here, that they felt safe enough to open up about their faith. And then we get into that and say, well, what would you like to do? I never say, okay, let's start praying. That's me imposing, right? So I bring it back to the person. This is what's really beautiful about Islamic counseling practices, is that we always give it back to the client. What would you like to do with that, right? This is your journey, your speed, your pace. What would you like to do that? If they say, you know, I want to pray. What would you like to do? How would you, do you want to incorporate that as part of your spiritual, let's say, treatment or your journey? as part of our action plan. Yes, you know what? I'm going to start working on my prayer. I'm going to make sure that I'm going to get up for Fajr. I'm going to set up an alarm. I'm going to do this, this, and that. I'm going to keep track of that. I'm maybe going to start reading more Quran. You know, I'm going to look at perhaps the way I'm dressed, maybe dress a little bit more modestly. They say that, not me, right? And so we will include that as part of our treatment plan. And moving forward, this is applied with our mainstream clinical practice, whether it's we're using cognitive behavioral therapy to help them change behavior. Some come in even having addictions, whether it's pornography, whether it's alcohol, whether it's marijuana or other drugs, Muslims, right? And so we work using on different strategies to help them. So you see sometimes the mainstream, right, can help with issues that are glaringly against Islam. So it absolutely can go hand in hand. It's truly the choice of the person. What they have to do the research, they have to be aware of who they're going to see, what kind of practices they're going to be implementing in the therapy session. Hope that answered that question. Alhamdulillah.
Dr. Sheikh, I would really value from your insight on this question as well.
Yeah, sure. So I think Sister Berak said it really, really well. And far be it for me to add anything in that respect. Let me say this, though, that from the perspective of being a Muslim and being a believer and being obedient to Allah, whatever Allah subhanahu wa ta'ala has decided, halal, haram, permissible, impermissible, do not do, is appropriate, is not appropriate, there is no question on that. So anything that is outside the limit of that, it's gone. You cannot apply it. Let me give you a simple example. There's data out there that suggests drinking a glass of red wine every so often is good for the heart. Yeah. And the data is fairly conclusive because it's got antioxidant properties in it. However, wine is haram. It is in the Quran. Khamar is haram. It is not permissible. It is haram to consume. It is najis itself. And so there is no question that you are not allowed to drink it, no matter what its beneficial properties to your body or not. So I think we should be very clear about that, that anything that God has deemed to be haram or impermissible, or that is outside the limits of the religion, that's it. It's outside the limits of the religion. Now it's what's inside.
Choice, right? Sorry, Sheikhna, and it becomes a choice here. It's there. You know it's permissible or not. You choose if you want to drink it, even if it has so-called health benefits. You have that choice in the end.
Yeah, absolutely. You had the choice. You had the choice just like everything else. So I think that's something we need to consider and we need to be very clear on, is that the law of Allah cannot be transgressed, should not be transgressed, and that in determining the applicability of certain approaches beyond what is considered to be impermissible or permissible, as long as it is mubah, it is acceptable, or it is allowed to be done, then Islam says, do what you need to do to improve your well-being, your function. And I think from an Islamic perspective, there is no question that Islam would advocate for the well-being of an insan, not just from the physical perspective, but from a mental, emotional perspective as well, and to address the circumstances that are going to cause a person not to be able to do so. So for example, I always take the example that, let's say I'm feeling really, really stressed, yeah? And I've got a lot of stress. I don't have any mental deficiencies, cognitive deficiencies, but my workload is so much that I'm feeling so stressed in life. And I need to find a way to deal with that stress. Why? Because it's causing me to snap. I'm getting angry. I'm forgetting things. The things that I want to carry out, I'm not able to do so properly. So what should I do? I go to a sheikh, all right? I can't see myself. So I go see somebody else and I ask them, and they say, oh, well, the Holy Quran, it says very clearly that by the dhikr of Allah subhanahu wa ta'ala, if you remember God, your heart will be tranquil, your heart will be content. And indeed, that's true. And we believe that with greater prayer, with greater focus on Allah, that we will be able to relieve the stress. But I will say this also, that second to that, or maybe third or fourth to that, I know that playing soccer for me is an outlet. I go out, I run around, I play soccer. I don't think about the problems of my daily life. Maybe somebody else goes and lifts weights. Maybe somebody else goes into the yard and plants and does some gardening. Maybe other people go on hikes. There is nothing wrong with those things. Why? Because it fosters mental well-being. And Islam says if that's what you need to do to foster your mental well-being, as long as it's in the limits of God's religion, there's nothing wrong with it. You do not necessarily always have to relegate yourself to going and doing extra 12 rak'at of prayer or reading 3 more dua from Mafatihul Jinan. It's good to do so. I'm not saying don't. I'm not saying that there's not benefit to it, but I'm also saying consider that maybe at this moment, along with that, you may need another outlet to find well-being, to find mental well-being. And Islam has no problem with that. There is no issue with that sort of thing to bring your mind back into a stable state.
Can I just piggyback off of that? Because I think you brought up something so important, Sheikhna, in the sense that a lot of people, and you hear this from the elders, and we've heard this common misconception all the time that people say to people who are dealing with depression, anxiety, you just need to have more faith in God. You just need to read more Quran. You just need to read more du'as. And you've just completely dispelled that by saying, in that moment, your mental, spiritual capacity is at the space where this is not the right treatment at the moment, right? It may need medical treatment. It may need, excuse me, psychotherapeutic treatment. This right now is not going to work. And again, I use that analogy of the broken arm. In that moment, is prayer going to help heal it? No, that person needs x-rays, medication, cast. Then we can talk about, okay, so how is this person going to pray now? Then we can talk about spiritual healing, helping this person get back on track. Absolutely.
Thank you both very much for your discussion questions today and very thoughtful answers. Just for the sake of time, I think we will move to a couple audience questions. This first one is directed at Sister Berak, concerning different medications like OCD and ADD medication for the youth and our young adults in our communities. The question concerns how do we deal with long-term dependency and the consequences of taking these different medications?
So this is an excellent question. Sorry, I just was choking off screen for a second there, so I look a little bit more red. So this is something we kind of answered earlier. It's a great question in terms of, I'm not an expert in the area, but I've definitely come across a lot of ADD, ADHD students where I've had to refer to specialists because this is an area of specialty. And a lot of these people have to take medication to the imbalance in the way of they intake information, right? So there is an imbalance in their makeup, their genetic makeup in their brains in terms of how they process information, their outlook on the world. And medications, we've heard of Concerta, we've heard of Ritalin, right? When it comes to ADHD and ADD, and a lot of these students or clients, when they have the specialists that they work with along with the medication, it's a trial and error, by the way, till they get the right amount of medication. And I've seen it work like this for some people. I'll give a quick story. So there was a young man, and he's given me permission, by the way, which is why I'm giving the details that I am. Otherwise I keep confidentiality of stories, I generalize, but this I have permission, where this young man he was a Muslim revert from down in the South, the Caribbean area. So he was struggling in school for a long time. He was a mature student. He was miserable. He's in school for such a long time, and he doesn't understand why. He's not doing well. He's depressed and very anxious. And so it took a few sessions. I didn't see it right away either. I was still in my early days. And even sometimes you don't pick up on it right away. But to the trained eye, you get it, right? Especially if you're a specialist in the area, which I'm not. But what we saw was that this person wasn't dealing with depression. The depression was a concurrent disorder that was happening because of his ADHD. He was always late and missing appointments, and that was costing him a lot of missed appointments when we clued in that perhaps this was the issue. And so we sent him to a specialist. He didn't take the medications once he was assessed with ADHD and was told, you need to take these medications. Ironic considering his mother was a nurse, but because of the culture, they said no to medication. The poor young man struggled again and again until I finally pushed and said, brother, please take the medication, please. And he finally did, alhamdulillah. I kid you not, the next week when he came to our session, I didn't recognize him. The heaviness of depression, the fatigue of depression disappeared like that. He was getting A's on his projects, his assignments, his quizzes. In that 1 week, he was retaining information. And on top of that, with the medication that he was taking consistently with the lifestyle changes we discussed, he was aware of other people who were struggling the same way that he had. And he told them, go and get assessed. Now, this young man, for the duration of his education, and by the way, alhamdulillah, he graduated and is working in his field. And he always sends me Eid Mubaraks and updates. And I love hearing from him and, sharing his story. He was a lifelonger as a student taking these medications. He didn't really need them later on. And what he did need later on was a continuous monitoring with the doctors in case he did went off track, and these medications needed to be tweaked if he needed to take them. We're always fearful of taking medications, like we said, in our communities because of the long-term dependency. Again, I put this back onto you to finalize this answer. What about the diabetics and the cardiovascular people who are dealing with those diseases? They need to take these medications, right, to keep things in balance. And if we can look at mental health challenges, disorders, illnesses, the same lens that we do for physical illnesses, this question has disappeared. It becomes a non-existent question because we don't have to deal with it. We're just going to accept taking medications just like we would for physical illnesses. Now, mind you, there are different alternative medicines, just like we would for physical illnesses, that also would work for mental health issues, right? So it's what you choose to follow, which specialists that you have, and there's so much choice out there. But I encourage my friends and family who are watching and who are struggling with this idea of dependency, please think back to the diabetic. Please think back to the person who has cardiovascular diseases. How do they deal with it? Right? It's the way we look at things. And we need to look at that here also when it comes to OCD, major depressive disorder, attention deficit disorder, any of these disorders that need the medication for that balancing back to baseline function. Because I've seen both. I've seen some people medication doesn't work, and I've seen people that's all they need along with the lifestyle changes. So I hope this answers the question.
So I don't think there's any sort of problem there, right? Because if you think about it biologically, it's the same mechanism. So why does a medication work? Why does insulin work for a diabetic? Because the hormone itself triggers the absorption of sugar from the blood into the muscles or into the storage sites of the body. Same goes for the cardiovascular system. There's a target for the medication that hits a receptor somewhere and causes a chain reaction. The brain and the mind are triggered by the same thing. I always use this example as well, is as a long distance runner, what happens when you finish running? You have a runner's high, which is triggered by lots and lots of endorphin, right? And although endorphins don't actually enter into the brain, they're too big, they circulate around the body, but they're a little too big to cross the blood-brain barrier. There is some data, there's some studies that indicate that endocannabinoids, like anandamide, I'm getting into the real scientific stuff that makes me happy.
That's amazing. That's amazing.
Anandamide is posited as being one of those neurochemicals in the brain that hits what are called endocannabinoid receptors in your brain, and they cause this pleasurable anti-anxiety feeling. Why? Because
it's like eating chocolate. It's like eating chocolate. It's like eating chocolate, the release of chemicals when you eat chocolate.
It's because that chemical hit that receptor, right? Just like you would for diabetes or for heart disease. And it's the same mechanism. It's the body responding to a chemical and initiating some process. So it should be thought of in that manner.
But Sheikh, now we know, see, you as a scientist, me as a clinician, we know this. The layperson who is not into science and in therapy, when we look at the mental illnesses, it's not the same way. They don't look at it the same way. That's where the fear and the stigma and the taboos and the misconceptions all come in. It's again, the same thing when we look at a physical illness. You see it, you see the broken arm, you understand the science that the Sheikh described here, right? It's almost like the question of faith, believing in God, even though you don't see him, yet you still do. So you do, right? And you do everything you're supposed to do because you believe. So here, same thing, you can't see it. So it's hard for you to believe it, that the medication will do the work. right? But the science, just because you can't see the mind, just because you can't see emotions, right? Then it's hard for you to understand or accept it. But when we're describing it this way, and when we look at modern research that proves what? Our own Islamic psychology, from the science and the medicine of the Ahlul Bayt alayhim as-salam, that's been proven from decades ago, generations ago, centuries ago, our modern research is showing and proving what we have known all along, right? One simple example. What did the Prophet teach us, sallallahu alaihi wasallam? And I love this because it's all about positive psychology. Tafa'alu bil khair tajidu, right? Propagate that positivity out there, you get it. There's a whole stream of positive psychology in that studies happiness and joy and contentment and serenity, that proves this, that it's all in the way that how you reframe that negative thought into a more reasonable, positive thought in terms of opportunity, and how you propagate that energy out there. How many of you have been around people and you feel the negative vibes off of them, or the Debbie Downers, as we call it here in North America? You're putting your hand up, Sheikh. Yeah, you feel that energy. Certain people that you pick up on their energy, their positive energy and their negative energy. People are drawn towards the more positive, the uplifted, the happy, the smiling, right? Which again, when I think about smiling is sunnah, right? The Prophet always talked, you hear about stories that he's always smiling, even though there was a lot of grief in his life and sadness, but he was always smiling when he greets people. Again, it's such a simple thing, but there's so much psychology behind it, which is why in my mind, like they're completely not separate. If anything, they're all like this, right? Now I sound like an excited 10-year-old, but in a candy store. But essentially this, for me, when I talk about mental health and psychology in Islam, it's all together. You cannot separate. Of course, like we said earlier, when you look at schools of thoughts and theories that are against Islam, and just like I respect the Sheikh, how he talked about the alcohol is there, the red wine, you can take it or not, even if the science says that it's okay. It's a choice in the end of how you want to apply it into your life. But please, let's work on the stigma and the taboo and the misconceptions around mental health and medication. We need to look at it just like a physical illness, right? Because mental health, essentially what mental health is, by the way, mental health is different than mental illness. Just like our physical health, right? What we eat, what we put into our bodies, our well-being. Same thing with mental health. It's the balance of all different aspects of our lives, which goes to the same hadith that I always use when I talk about wellness and balance of Imam Musa al-Kadhim. And I'm absolutely paraphrasing here because I don't have it in front of me. But in terms of dividing up your time and an hour to God, to family, to work, and to yourself. See right there, those four aspects talk about the overall wellness and balance of everything in our life: financial, spiritual, relationships and connections, the individual, the self-actualization, et cetera, et cetera, et cetera, right? So it's all about that balance. How is this not compatible? It is absolutely compatible when we look at it this way.
Thank you so much. I feel like that leads us perfectly to our final question for tonight. And I think this is going to be a great way to wrap up all of our different discussions today. So concerning the misconceptions that we carry about mental health, for example, that only those with physical signs of mental instability are those who require mental health supports. In reality, mental health is a condition in our day-to-day function if our day-to-day function is impaired or impacted. So which conditions require or don't require mental health support? Sister Berak, if you could share a few final thoughts.
Do you mind just repeating the question? I'm trying to find it in front of me here. Is it?
Yes. Which conditions
require,
don't require mental health support?
So which conditions do and which don't? Okay, so that's a very huge question, which I can't answer like that. How I will answer it is this way. If you find that you are having highs and lows, and you're not into things like you were before for, let's say, a very short period of time, you're probably just going through a phase, right? That you're not into things like you were before. Perhaps there's hormonal levels if you're a female, which is very normal with the menstrual cycle, right? You're going to have highs and lows with what you eat, your interactions. It's temporary, right? You don't really necessarily need to go and get support for that unless you're dealing with really, really severe hormonal imbalances, which we have seen, whether it impacts the moods or physiologically, where you do get medication and support with that, right? But generally speaking, right, then you have just the winter blues, let's say, right? And it's just for a short period of time. You could get help with that. What we define as something perhaps clinical, or where you should go, and we recommend that you go and seek support for, is when it is interfering with your daily functioning, right? For more than, let's say, 2 to 3 weeks. So in this case, if it's been consistent, let's say your hygiene is off, right? I'm describing perhaps symptoms of depression here. You were severely in that state of sadness, of grief, or not engaging with things that you were once excited about or found pleasure in, like perhaps soccer, football, or going to a Suns game, right? Or perhaps the foods that you enjoyed, or I'm going to try and be serious now, right? Or the way you interact with people. If you're a student, your grades at school, perhaps your friends, the community. If you're not engaged once, like you once were, perhaps your hygiene is off, right? Let's say you are constantly sleeping or undereating, overeating, oversleeping, right? These are the typical symptoms and signs of depression that we see, that if, let's say, they're consistent over a period of more than 2 weeks, that's when we would go and get support. Go first see your medical doctor. Ask those who know, right? Go see your medical doctor. They will do the initial mental health assessment. Some medical doctors may not be trained in this area, although guaranteed most of them now are, especially in this day and age of the pandemic. We know at my clinic, all the doctors have the mental health assessment ability, so to speak. And then they will refer you to either a specialist or a counselor, a psychiatrist, or whoever needs to treat you the way, depending on what you bring in, right? So this is for depression. For anxiety, it could be the constant worrying, the shakes, the anxiety attacks, constant fear of the future. And this can bleed into, let's say, OCD, where when it comes to Muslims, the najasa, right? The constant worrying if you're in tahara for salah, if you said what you needed to say, and constantly going back and worrying, did I complete my prayer right? Did I do my fast right? Did I do anything to invalidate that constant shak? That's when it's like consistently all the time. And some people with OCD with tahara, whether it's using sanitizer or water and soap, their hands become raw and that becomes to have skin issues, right? And although I cannot treat that per se because it's related to OCD, a psychiatrist or a medical doctor would, that would be something that, if it's gone to that level intensity, then I would be concerned and I would go seek support. Somebody who is talking about dark thoughts of wanting to harm themselves, whether it's cutting or wanting to take pills or substance abuse, or saying things such as they want to end their life, they are not happy, and so on and so forth, that is also a sign of concern where I would go and get support. I've done lots of discussions, if you go on the Muslim Counselor page, where I specifically talk about that, which I can't do all right now because of time. So I do ask you to go there. I ask you also, for those of you who are listening and who are triggered or want to know where to go, you absolutely can use the Nasiha hotline. You can easily find them on the internet or on Instagram. And those who are watching who are abroad, let's say in Europe, you can contact the Muslim Youth Helpline. It's free hotlines from Muslims who can help and at least connect you or help you initially. They're distress call centers. And I work with Nasiha closely, so they are a trusted source for our community as well. So I hope this answers it. If it is more than 2 weeks consistently off with these types of things that we have described, or if somebody's having a mental breakdown, right? They're a mental breakdown, or if they're hearing voices, like some of the things we described. And if we take a look at, let's say, abuse, right? That is also where you need to reach out and get the appropriate support, whether it's from the community or the appropriate mental health support. So this question is a whole session on its own. I hope I've been able to summarize it. And for those of you who do have more questions, please do reach out to the appropriate resources that I have provided. You are more than welcome to reach out to us, and we will connect you to the appropriate supports. I do not do, and I repeat, I do not do private practice, but mashallah, so many people daily contact me. I do have a list of references of Muslims who are practitioners from our community that be more than happy to connect you with, inshallah.
Thank you so much, Sister Berak. I feel like you just wrapped up everything so neatly. And I would like to ask Dr. Sheikh to please recite a closing dua for us.
Thank you, Melanie. So before I recite a brief dua, I just want to thank both of you for joining us at the Imam Mehdi Association of Marja'iyya's webinar, and to our fellow brothers and sisters and listeners who are enjoying this program and benefiting for sure, inshallah. Look for more material. These are discussions that we need to continue. We need to dispel the myths and the misconceptions. because Islam is a religion that promotes well-being and wants human beings to be functional, wants human beings to be well-adjusted, happy, and in their lives in such a way that not only do they fulfill the obligations of Allah subhanahu wa ta'ala, but find happiness, find contentment, and find fulfillment, whether that's personally, whether it's interpersonally, or whether it's through whatever they do in their lives, their career, their education. So please send your questions, your comments, and look for new material. Look for educational material and guidance on these topics, particularly from the mental health, psychology, education, and Islamic practice perspective, inshallah. أقول قولي هذا واستغفر الله لي ولكم. بسم الله الرحمن الرحيم. اللهم إني أسألك بحق محمد وآل محمد عليك صل على محمد وآل محمد واجعل النور في بصري والبصيرة في ديني واليقين في قلبي والإخلاص في عملي والسلامة في نفسي والسعة في رزقي والشكر لك أبدا ما أبقيتني. بسم الله الرحمن الرحيم. اللهم كن لوليك الحجة ابن الحسن صلواتك عليه وعلى آبائه في هذه الساعة وفي كل ساعة وليا وحافظا وقائدا وناصرا ودليلا وعينا حتى تسكنه أرضك طوعا وتمكنه فيها طويلا وهب له رأفته ورحمته ودعاءه وخيره وصل اللهم على محمد وآل محمد.
Just a final thank you to all of our audience members for actively engaging with us, asking your very good and relatable questions, and for sticking with us for the duration of our discussion. A huge thank you also to Sheikh Hazari and Sister Berak, of course, for their beautiful thoughts, and to Imam for holding our webinar series. I pray only that we can gain a sense of well-being or empowerment from being in each other's virtual presence. And just a final thank you to everyone for joining us tonight. Assalamu alaikum.
Assalamu alaikum. See you next time, inshallah.
Thank you both.
Thank you, Shaykhna.